Our podcast originated from two inquisitive women in their 60s, walking around in New York City and talking and listening to the seniors who offered us generous, interesting, and inspiring life stories. Hi, Katie. Thank you so much for coming to the studio.
Hi, Katie. You look so great today. Love it. World map here. You're wearing it.
Thank you for having me. I'm excited to chat with you ladies.
Katie here is, well, too young to call senior, but she is an expert in the lives of senior citizens. And she's a geriatric nurse.
A holistic geriatric
Right,
nurse.
both.
Which I found very interesting, which I want to know more about.
Yes. So what inspired you to become a holistic geriatric nurse?
So I initially went to nursing school, and when I first was studying, I wasn't really sure that this was, something that I kind of, because, you take care of people, maybe why don't you try it? And I think it wasn't until after nursing school and taking care of people that I realized, oh, okay, this is why I'm doing this. And shortly after nursing school, I was finding that I've worked in long-term acute with patients on vents and all sorts of comorbidities, heart disease, diabetes, orthopedics, post-surgical, psych, all these different areas, transplant. And what I realized was that a lot of times we were just putting a Band-Aid. And I couldn't seem to, a lot of times I would be spending a lot of time. And people would say, you can't spend that much time. We have too many patients. And you can't help this person. And so a lot of times that was, to me, there was something that I was like, but there's more to this.
That's lacking for you, yeah.
There's more to this story.
Yeah.
And in that same time, through word of mouth, friends and family would be referring their grandmothers to me to help. And at the time we were living with my mom's mother, who had Alzheimer's, and my dad's mother, Nani, we were very close to, had diabetes, and so I was always sort of intrigued with geriatrics in terms of not necessarily geriatrics per se yet, but just that time from the turning of age. I loved kind of the turning of age time in old movies, and with my mom we grew up watching Shirley Temple and musicals.
Oh yes, I remember. That's lovely.
And the black and white movies. So and at my Nani's house, all these kind of old trinkets and learning about our grandfather and so
and the stories.
And so
You were close to your grandparents?
yeah, well, my grandfathers passed away before I was born, so I had two grandmothers. My Nani, who was close by, and then my mom's mother, she was from St. Louis, moved closer to us later on. So she would visit every time my mom had a baby. I'm one of 9 kids, and so my grandmother would come every time, and visit other times too.
Okay.
And make Czechoslovakian cinnamon rolls and donuts. So we, but then when she lived with us, that was when I really, got to know her, and we all could help take care of her at the house and.
So
and
you're
everything
from
like
a
that.
big family.
Yeah.
That's a very big family.
Yeah, so a big family.
So where are you in the 9?
I'm the 4th oldest, and since then my mother and brother passed away, and so that's another reason why I got into the holistic health. We always kind of grew up, and my mother always said, emotionally, spiritually, and physically to be healthy.
Yes.
In all those kind of realm, but things are a lot more confusing nowadays, and so I was always sort of searching. And after both of those situations, it got me more to searching, like especially when doctors say, and we don't know why this is happening. So I started doing my own research, and I really should probably write some of it down and do some case studies. But I, in the hospital, I would ask, well, when did this happen? When did you get this fibromyalgia? And you would hear, after my husband left. When did you get this, cancer? When I was 12, after I was uprooted from all my friends and family. And I started gathering my own research.
You're putting all the pieces together.
Yeah.
By your questions.
But yeah. And so then I was taking functional medicine courses, the Institute of Functional Medicine, and learning about diet and lifestyle.
That's part
and
of the holistic?
Yep.
Okay.
Yep, so learning about lifestyle, sleep, stress, nutrition, social circles, and all of that.
I find that very fascinating because it's true. It's true. A lot of these illnesses, you can trace it back if you ask the right questions. Mm-hmm. And then you organize it, and then you see a pattern.
Right.
Doctors never take time to do that, to listen to what was the root cause. Usually they give the medicine to do.
They do the Band-Aid, give you the medication, and bye.
Well, the system itself is not built to be able to have time, and with insurance and pharmaceuticals to take that time. There is a program in New York. It's called the Lifestyle Medicine Program, and they have been put out to all the 5 boroughs, and anyone with hypertension, diabetes, obesity can go to this program for free, and you meet once a week. They have coaching. They teach you all about lifestyle, diet, sleep.
How do you call that? Lifestyle?
The lifestyle medicine.
Medicine.
And it's and you don't need it's self-referral.
Oh, self-referral?
And how they do it is they do, for example, like an NP visit would be an hour, but it would be an exercise class. And they do videos so that the patient is becoming the expert.
Let's see.
And so they become empowered.
Right.
And so it's a really nice program. And so I've been recommending that to a lot of people.
I think one of our guests would be interested in something like that because she's trying to go through her own journey because she's a caretaker. Mm-hmm. And I think that would be something good for her to do, I think.
Oh, yeah. I think the caretakers, because there's that constant pull of I care, but I can't get too invested because then I get sick. And so when we find that that's starting to happen, we have to step back and take care of ourselves and kind of surrender, okay, I can't solve this whole problem sometimes, or this person doesn't want to be helped, or like I said, the system doesn't have the resources to completely help this person. So it can be a tough kind of pull between what people are willing to do and what people are not willing to do.
I'm curious, what is your day? Well, you don't have to say the entire thing. What's your day like, when you're working with your patients?
So it depends. Usually I go in, if it's a private patient, I'll go in for, at least a couple hours, usually more, because I'm trying to get to know them. What are their likes, dislikes? Obviously the basics, what medications are you taking? What's your kind of sleep patterns? Are you going number 2? All these kind of things. What are you eating?
Have to know,
What's your stress level? What are your diagnoses that you already have? So that might be what a first visit might look like. And then we work with each other. So I just had a patient that, it all depends on what they want to work on. I don't know if I should go into this now or later, but just
in general,
Yeah. So one person, they had a anxious, but they had allergies, and I found out they were taking a lot of albuterol, which is a rescue inhaler. So,
Oh,
okay, well, that means that probably the daily one has to go up then if you're taking the rescue inhaler that much, because they were really anxious and naturally already had an anxious personality.
right.
And so, and then working with them, like, well, how are you sleeping? Well, I'm not sleeping. And have you tried this? And, I'm not going to make, like, totally recommendations because, but as a nurse, but for example, one thing, with melatonin is they're finding a lower dose around 5 or 6 is better than taking a higher dose closer to bed.
Interesting.
And so things like
okay.
that, and, the older adult, the B complex is really good for the older adult because they're not able to break down as well, meat and things like that. And,
I
if
didn't
somebody's
know that about the B
vegan,
complex.
then it really helps with the nervous system just to calm and then also
see.
energy. So
It's kind of complex.
there's
It's
a lot
B
of
complex. My mother takes those.
Yeah, yep. And the B complex, it's one of those things that you will get rid of it, and some people may need more than others. So kind of looking at that, and I think sometimes, for instance, someone might have a hearing problem, right? And they just say, these hearing aids don't work, and they throw them out, they don't use them. Well, what they don't know is that it's like one of the,
Adjustment?
that they could be adjusted in so many different ways.
Right.
So maybe, so they don't know that they could be adjusted for, say, a crowd, or when you're out at dinner, or when you're in a group just one-on-one.
Various occasions.
And when you don't wear them, it's the same nerve as the brain. And so then you start to lose your memory.
You start losing it. You're not
Because
using
you're not
it.
here-
You're not using it either. Yeah.
So that can be something. So some of these things that, people aren't necessarily aware of, and they're just sort of little tweaks sometimes
I see.
that can make a big difference.
Maybe it's the way I searched, but I couldn't find so many information about geriatric nursing. There's no YouTube information.
That's a very
like what you're
specialized
saying.
field. Even doctors, there's only so many doctors.
It is specialized, but it's a very needed, knowledge these days. And
Yeah, it's sort of like pediatrics where they have their own sort of specialty.
Right.
A lot of times I will recommend older adults to get a geriatrician
Mm-hmm.
because they are looking at things more holistically, and I like to simplify, so not to keep things complicated. So there was a story of a client I had. She had dementia, and so they ended up getting a nurse's aide for her. And so I was overseeing the situation, and at night she would go out to get Chinese food because she was hungry. So that was making her blood pressure skyrocket.
Yeah.
The salt.
Then
The salt, yeah. all
she
that.
ended up going in the hospital, and she came back from the hospital, and she had a urinary Foley catheter, and then she had an aide that was with her and helping her eat and things like this, and over time of getting to know her, I realized, wait a minute, one of the aides told me she spends a lot of time in the bathroom, and so I thought, I wonder if she's going to the bathroom. Number 2.
Yeah.
And I said, do you smell anything? She said, no, I never smell anything. So I'm like, I think she may be, having trouble there.
Right.
And I asked her, I said, oh, yeah, well, I, have my whole life I've had problems, with that.
Oh, okay.
And everything like this. So long story short, we go on a regimen with her, and I try to help the aides to eat more fiber, fruits and vegetables in the diet.
Right.
But a lot of times, sometimes if someone's older, they have what they like, and what they
build
don't
their
like.
pattern.
So, so I spoke to the doctor, obviously, and we increased her bowel regimen, and now she was going every day, every other day. Well, all of a sudden, she started having sort of the urge to go to the bathroom again, to urinate, number 1. And so we were asking the urologist, can we do a voiding trial and see if she goes to the bathroom? No, she's not contracting. Her bladder is not contracting. We've done the test. I said, do you think that her being constipated could push on the bladder and cause so that there's not enough space to contract.
Right.
And because 20 to 30 years of her or longer, she said
Right.
her whole life, but
She's been having
where
these
it really
problems,
affected her. And says, no, it's not. But we really wanted to try it, and her family member also really wanted to try it because it was getting to the point where she would go to the bathroom even though she had in the catheter. And so we were like, we needed to listen to her. Yes, she had dementia, but she still knows what
she can
she's
still articulate.
She can still articulate what she's feeling. We need to listen to what she's saying. And so we take the Foley catheter out, and they do the trial, and they were only able to get a little bit of fluid in her, but she emptied it completely. And the doctor said, no, well, it's inconclusive, the test, because we only put a little bit in her. I said, do you think that's because of years of being constipated, her bladder must be smaller? And I apologize to talk about this on the podcast, but I think it's a very important issue for the older adult.
Good.
Yeah.
Because I think people are embarrassed to talk about it, and they don't want to spend too much time going to the bathroom. And so if they can't go, they don't think it's a problem. So long story short, now this patient is urinating fine on her own, completely fine.
Nice.
And the doctor said, we'll see you in 6 months. And all because she was constipated. And we had to deal with that, getting her
That issue
resolved. And now she doesn't have something inside of her that was, an extraneous thing and causing urinary tract infections,
all
which
these
is
all
these other problems.
Yeah.
And then another thing was that she wasn't getting out of bed until 4 p.m. And so
she's not moving around.
She wasn't moving around, but she was feeling weighed down.
And because she wasn't,
So they put her on a anti-anxiety medication, but it wasn't really working. We didn't really notice a difference. And then her blood pressure started going down because she wasn't wanting to drink, and she was on a diuretic, which helps get rid of urine. Right. So she's losing a lot of fluid.
Yeah.
Then the potassium is low, but they can't really get her to eat. So again, talked with the doctor and said, do you think we could lower the medication of the blood pressure? I think it's, her blood pressures are low enough now that she doesn't need the higher dose. And at some days we've had to hold the blood pressure medication. We've discussed certain parameters with the doctor. And she said, okay, so we lowered the dose, we took off the diuretic, and she's a completely different person now, getting up in the morning and showering before the nurse's aide even gets there. Yeah. And before it was a struggle. So it's sort of these little tweaks, but
it's a big advocacy that you really helped speak for her. And
she spoke for herself too. Yeah. And you listened to her.
Yes.
Yeah.
And that's very important because
yeah,
they will need that. This one person who listens to them and facilitate whatever is needed.
And it takes time of that kind of like.
Yeah, I think you resolve that like in one day, no way.
Right, and consistency of me seeing her say, wait a minute, because it took sometimes you can kind of go in and you do your thing and then you have to go see someone else, and so kind of it takes time of that going and seeing the patient and seeing what is kind of going on in reality, which I think sometimes when someone goes to the office, they're surrounded by white walls a lot in the doctor's office.
Right.
So it doesn't really jog the memory a lot of times of what they're doing. So, everything's great, and, I would go to the house and say, well, what's this or what's that, and it kind of jogs their memory to talk about something. Oh, yeah, well, you know what? Every night before I go to bed, I'm chugging, a big glass of water, right before bed. And but that wouldn't come up in the doctor's office. So the results are sort of sometimes inconclusive. We don't know why this is happening. And so then sometimes going into the home, you're able to kind of piece together a little bit because you're given more clues.
It's a big mystery.
That's true, because when we had like a home visit beforehand, I had my mother write any questions down Because, at that, she's 89 years old. She's not going to remember. She'll forget. So she asked certain questions from the nurse protector, even about my father that has dementia. And it was very productive at 1 hour.
Yeah, I would recommend whenever you go to the doctors, have your questions.
Written
And then
down.
you say, I have 3 questions. Number 1. So that way, a lot of times then they have to run out the door. That way you say, I have 3 questions. Number 1. And then he'll even start saying, well, what's number 2? What's number 3?
I see.
He or she. So that, so then you don't, oh, well, I forgot to ask him that, So that's a tip for going into the doctors.
That's what I find. You have to be somewhat prepared.
Right.
Or whoever is taking, or as me as a part-time caretaker, have her write those questions. Those are her concerns.
It sounds really great way to do it. Like, it's a practical advice. Why did I forget that? I think every time at the doctor's office, why didn't I not written down the questions? Because you just
Because
have to
I think once you get into the office, you're like, okay, everything's fine. Just get this over with.
yes.
I'm done. Goodbye.
Yeah, as soon as doctor's office, I need to get out. But you are dealing with a group of doctors. Like, you are like a team.
So I basically, when I have a private patient, I work with whatever doctor they have. So they might not, some that we meet are into holistic functional medicine, but not all of them are. And so, but just bringing up, other things. Oh, I'm having a lot of bruising. I'm on aspirin. I have AFib. Okay, well, would it be possible to go down on the aspirin a little bit? But they might say no, the benefit of the aspirin outweighs the risk. But other times, if they're finding 3 times a week studies show is okay for the older adult. But all these things, everything that I'm saying, don't just go and do this. But these are things to ask the doctor. Could I go down to the aspirin 81 milligrams just 3 times a week? I have one patient, she gets bloody noses, so she doesn't actually take it. So, everybody's different, and listening to your own body, and really, if you feel like you need an advocate, to bring a friend, or a nurse with you, or a family, because it is kind of scary. Even myself, when I go to the doctor, I get nervous too, and so we freeze up and we forget to ask those questions. Another big one for elderly to ask is to get their vitamin D checked and their B12 checked. So because the vitamin D can cause a lot of issues as well.
That's true, because I had my vitamin D checked. I didn't realize it was so low.
Exactly. And if you have more tan skin, you actually need more vitamin D.
Yeah, because I was telling my doctor, I'm an avid walker. I'm outside.
Yep.
And he says you're not producing enough D. It doesn't matter at your age.
Yep.
Wow.
And everyone's different. I have one patient who, she has a kidney, stage 3 or something kidney, so she processes things a lot slower. So for her, for example, she's on cholesterol medicine, and it did help. She's only on it twice a week, and it's working just as well, for someone else. So it's kind of really looking at each person and seeing what's working, and being willing to, as an older adult, people say, "Oh, you can't teach an old dog new tricks." Well, you can, and actually, it's good for your memory too to be learning new things. And it's not just about getting good at those Sudoku crossword puzzles. It's about learning new things. So taking a new way home, or learning a new skill.
Wow.
So those things are all going to help with your memory. And don't be afraid to try new things and to change it up.
Do you have any success stories, sort of, like, from your way, like, meaningful experience? or like a success story because of the specialty, the kind of rare specialty that you have, the combination of holistic and geriatric?
Well, I think the one I mentioned about the lady with the catheter was,
I see.
we were just, she was ecstatic, the family was ecstatic, the aide was ecstatic, and
see.
I think that definitely, and we'll continue working with her to see if maybe she doesn't need the anxiety medication anymore because she's off of the blood pressure medicine is lower now. So now she's up and about and she doesn't really need it. So kind of getting off the medications that aren't needed anymore is important. There was another lady, I would see her in a nurse. She's lived in a not a nursing home per se, but sort of.
Like group home?
And she had Lewy body dementia. She wasn't eating, and that's how she sort of, from lack of nutrients, ended up getting that. Just living off of saltines and ginger ale. And one thing with her was that the facility was so short-staffed, and this is a problem in a lot of places, so they don't have time to actually sit and eat with someone who has Alzheimer's. But that's actually a nursing intervention, but insurance doesn't cover that, right? To sit and eat with someone with dementia. And many times the food needs to be cut up. For some, it depends on the level of dementia where someone is, but the food needs to be cut up because if they just get a big hamburger on their plate, they don't know what to do with it. And so having little...
Because they forget how to cut the food.
Right, and having little things. So I noticed they would put the tray down, and she wouldn't eat. And I said, oh, she doesn't eat, non-compliant, right? Non-compliant. This happens a lot, even with people on insulin or diabetes, things. Non-compliant. Well, why aren't they taking it? What's going on? So what I found out was that she had a shoulder pain, and the table with her bed, it was at a very awkward position. And so it hurt to lift her arm up and eat at that level. But she didn't know how to communicate that she had pain. If you said, do you have pain, she would say no, but she would lift her arm up and say, ow. So it's sort of all these little things that over time, then we started going down in the cafeteria, and I would be eating with her, and the table was at a better height. And then she would say, well, what do I do with this? Oh, yeah, well, why don't you try the green one? And why don't you try this? And she's eating, So so that's another little kind of, story about that, about just the observations and taking into account, especially, what someone is saying. It's important. There was another lady, she was having urinary urgency, and they couldn't figure it out. Inconclusive, again, those are the ones that get me like, well, there's something else going on.
There's something else behind that.
Yeah. So I was in her house, and she, looking at it, said, well, what are you eating? Her husband had passed away. What are you eating? Oh, I'm just eating cake and ice cream, and I'm drinking, are you drinking? I'm drinking coffee, and she opens up her fridge and soda. And I said, how much are you drinking? Well, I have about 4 cans of Coke, which is all caffeinated, and at least 2 to 4 cups of coffee. Well, that's going to cause urgency, and then also having weak muscles. So that was, so those are those things sometimes, those little, and then realizing sometimes how our mind affects the body, and what that can do as well, and how it can help or hurt us.
Okay. Yeah. So, the Phoenix Club that you introduced me to, are there more initiatives like that in the New York City?
I'm not sure exactly to that regard, but I do know that New York City, I feel like, is a great place for the aging because there's just so many things happening. And I don't think the older adult has to limit themselves to only things that are happening for elderly. And so I think that could be a brain sort of blocker in a way that, it is good, but to, meet other people.
They shouldn't just strictly stay at senior centers.
Right.
Exactly. Like it's the, I have some older friends, and so you don't need to just limit yourself to that. I think it's the same with the elderly is not saying what you can't do, but what you can do and leaning into that. And the more you start continuing to find evidence that you can do certain things, the more you're going to realize, oh yeah, I can do a lot actually.
So that leads to misconception of aging. You see a lot of them through your work.
Or even, for example, people don't want to use the walkers or the canes because they don't want to look, quote unquote, old. But using the walker or the cane can sometimes give them more freedom because maybe they're not going out because they don't want to be seen with the walker or the cane. But the gift of meeting people and going to museums and socializing is really, it really lifts the spirit. And that's one of the other misconceptions is that that we all need community at every stage, but especially at the aging stage, because a lot of times friends and family have passed away a lot of times, and so it can be, your health can actually deteriorate more when you don't have relationships
because you're lonely.
Because you're lonely.
Yeah.
And that leads to depression. So one thing I might ask someone is to see kind of their mood. Well, what are you doing? What are your interests in? And like, are you getting up and going out? Because if they're not, then there could be some underlying depression there when they're not doing things that they love to do in the past and getting to there was another success story of a guy who he wasn't taking a shower, and they were trying to get him to take a shower, and come to find out he had fallen a couple times in the shower.
So he was
afraid. So realizing that he was actually afraid. So then I started saying, well, how many times have you taken a shower in your life? Well, I took it every day since I was, however age. I said, so what would that be? What number would that be of an amount of showers? And, he calculated, however many showers, right? A lot of showers, because I think this guy was 96 or something like this. So a lot of showers. So what is the chance of you, falling versus not falling? You took that many showers. And so that kind of changed his mindset. Oh yeah. And then obviously safety issues of getting a shower chair and things like that.
Yeah,
and,
just to assist him. Yeah. It's just, those questions you have to just either have somebody there to help you, or because a lot of seniors don't know what to ask. They feel they're lost. They're in their bubble. Nobody cares about them, but there are people out there that care about them.
Exactly, and I think it's important to rule out the things that can be fixed. Even with the lady with the catheter. At first, the family member said, it's just the dementia, and I said, well, I want to rule out a couple things first. One of them was the vitamin D, as I mentioned, and hers was fine. And then I wanted to rule out infection and some other things, and the constipation and these things, and the blood pressure. And lo and behold, those things really benefited the patient, as opposed to just saying it's the dementia. It's getting worse. And that can happen also with infections, too.
It's very easy to dismiss.
Yep, because with the elderly, there's a lot of symptoms that are... that, for example, for infection, a lot of times it's not the basic symptoms that somebody else gets. Even with pneumonia or urinary tract infection, you might be malaise, you don't want to eat, you're sleeping all day, you might be really anxious, you might start yelling at someone.
Like
so
emotional
stuff. So the symptoms are a lot different, and so being kind of keen to those is important.
Thank you very much.